You have probably heard the adage, if it was not charted, it was not done. However, staff must use discretion and be thoughtful in their approach to documentation. Since the chart is a permanent record that is admissible in court-ordered legal actions, healthcare professionals must exercise extreme caution when documenting. The following is a very general list of areas where staff need to proceed with caution.
So, never document care before it is provided. Care staff should never chart assessments, medication administration, or treatments prior to actually completing the tasks, because this may contribute to an inaccurate record filled with incorrect data. If the medical record contains nursing care that was never performed, this is fraudulent in some cases. Always remember that other clinicians may depend on correct documentation to assist in formulating decisions regarding the patient. Do not routinely document care rendered by others. It is allowable in several instances to document care tasks or procedures performed by another individual. However, the documentation in the medical record must clearly indicate the individual who actually rendered the care. If the visiting nurse applied the treatment, be sure to identify him or her as the person who carried out the task. But do not regularly chart actions that have been performed by other people. If a coworker or superordinate does something incorrectly that results in patient injury or death, you do not want culpability. Never leave blank spaces between entries. In this day and age of prevalent electronic medical records, some facilities and healthcare settings still utilize paper charting. Nurses who still use paper and pen to chart must never leave blank spaces between entries. These unused spaces might be used by others to add questionable notations, so always be sure to draw a line across the blank spaces in the blank area. Do not chart that a patient is in pain unless you have intervened. Patient complains of radiating chest pain without subsequently documenting what was done about the issue. Thoroughly chart all notifications, interventions, and actions taken to avoid liability. Do not record another patient's name in the medical record. Let's assume that Mr. Wright gets into a physical altercation with his roommate, Mr. Robinson, violating Mr. Robinson's confidentiality if she documents his name anywhere in Mr. Wright's medical record, and vice versa. To get around this issue, employ a vague description such as the roommate or the patient in bed A. You can also use their initials, but not their name. Okay, so up until now, does anybody have any questions about what we've read up till now? Concerns, scenarios you've run into that you might question? Well, how would you?
I learned something.
Or something you've learned from this that you didn't know before?
I learned do not record another patient's name in the medical record. I didn't know that in the beginning when I first started.
Okay.
But now I know.
I'd like to know why, what we do if we do not document and need to come back, since you've got lines there. How do we fix that?
You put a late entry and get a whole new sheet with the proper date, time, and signed. And you leave that in with the record. But you must put in front of it late entry.
Okay.
Any other questions?
No.
Anything anybody learned new, didn't know about?
The progress notes for documentation, when one person has written, say, January 31st, 2018, and the time, the 7 to 3 shift, and then do you put in the new date, or do you just continue down and just put like, well, then it's like now the 3 to 11 shift, or the 7 to 3 shift, and then once they write here, you have
Sure.
a blank, you're supposed to put a line through that?
Correct. Correct, and we'll talk about the date and time when we do the actual sheet together, but correct, writing the line at the end of your entry, if you stopped before, you want it to go to the end of the page. You want no space between your entry and the next person's entry, no space. There should be a line drawn and then initial it.
And why is that?
Usually I put my first initial, my last name. You can do it any way you want, but it's kind of helpful when some people have the same initials. The reason that is because people can actually come in and add something to your documentation and it looked like you wrote that out. And they didn't initial it and it looks like your entry. If it does end up in a court, you have to argue back and forth how and where that entry came in. You've just eliminated any involvement you would have in a court hearing by that one line and initial.
Whenever possible, do not document subjective descriptions. Attempt to refrain from charting subjective descriptions such as patient's blood pressure is really high. Obtain accurate vital signs, checks, intakes and outputs, and other objectively measurable data, and record this information in a timely manner. Do not openly criticize the care that was rendered by a coworker. The medical record is a group of documents that should provide a comprehensive view of the patient's condition. Conversely, the medical record is not appropriate for criticizing care performed by other members of the healthcare team. Criticisms in the notes will accomplish nothing other than perhaps fuel the fire of state surveyors, malpractice attorneys, and anyone who happens to read the chart at a later date. Do not mention short staffing in the medical records. Documenting the existence of staffing issues in the medical record rarely, if ever, helps to increase the number of staff members. On the other hand, medical malpractice lawyers love reading progress notes that provide details about facility's lack of staff. Do not make insulting references to patients while charting. Try to avoid referring to patients as drug seekers, rude, vulgar, profane, or crazy when documenting. Utilize objective phrases and direct quotes whenever possible, such as patient states to this writer, "You are a blank B word in parentheses, and I will kill you." Do not ever document the existence of incident reports. Never document the preparation of an incident report in the notes. The incident report is an internal document meant to facilitate improvement of systems and processes within the healthcare facility. If you chart a note describing that an incident report was completed, this internal form now becomes subject to discovery by external medical malpractice lawyers if legal action were to arise at a future time.